In many African health systems, health workers operate in mobile-first environments, often with limited or inconsistent connectivity. This means that even basic tasks like accessing information or communicating with colleagues depend heavily on these foundational skills. Without this foundation, it becomes very difficult to progress to more advanced digital health competencies. But this raises an important question. How do health workers actually move from basic digital literacy to true digital health proficiency? What does progression look like from foundational skills to intermediate and to advanced capability? This is exactly what we'll explore in today's episode. We will introduce Digital Health Competency Pyramid and map how digital literacy develops step by step, from basic skills to applied digital health proficiency in real service delivery contexts. Let's begin. Welcome to Digital Literacy for the Health Workforce course. In this course, we'll explore how health workers can move from simply using devices to confidently working with data and ultimately engaging with emerging technologies like artificial intelligence. Today, we shall delve in Module 1 of this course, Foundations of Digital Literacy. I am Vivian Korir, founder First Elevate Africa, and I'm excited to guide you through this journey. Before I proceed, please subscribe, like, share, so that you don't miss future episodes of this course. In this first module, we'll build the foundation. We'll start by understanding the Digital Health Competency Pyramid, then introduce digital literacy, explore common misconceptions in digital literacy, and finally look at digital devices. By the end of this module, you'll be able to analyze the Digital Health Competency Pyramid and determine your own competency gaps across its 4 levels. Explain common terms in digital literacy. Acknowledge, appreciate, and challenge common misconceptions in digital literacy. And identify and describe common digital devices and their basic functions. As you go through this module, keep asking yourself, where am I now and what do I need to move forward? We begin with Unit 1, the Digital Health Competency Pyramid, and in later episodes, we shall look at the other 3 units. By the end of this unit, you will be able to explain the 4 levels of the Digital Health Competency Pyramid, differentiate between foundational, core, and health-specific digital skills, discuss what we call the digital divide shift, identify where you currently sit within the competency pyramid, and describe why digital literacy is essential for safe and effective healthcare delivery. As we go through this unit, I encourage you to keep reflecting, not just on what you are learning, but on how it will apply to your daily work. To understand digital literacy in healthcare, we use what we call the Digital Health Competency Pyramid. This pyramid has 4 levels. At the base, we have foundational skills, then core digital skills. Above that, we have digital health in practice, and at the top, we have future-ready skills, including AI and innovation. Think of it as a journey. Not everyone starts at the same place, and that's okay. As we go through these levels, I'd like you to think of them in a simple way: access, use, and application. Level 1 is about access, Level 2 is about use, and Level 3 is about application in healthcare. And as we move through this journey, you may begin to notice where the biggest challenge lies. Let's look at the 4 levels in more detail. At the base of the pyramid, we begin with Level 1, foundational digital skills. These are basic skills like using a phone, typing, or navigating the internet. These skills may seem simple but are essential because all digital health starts with basic digital literacy competence. Building on that foundation, we move to Level 2, core digital skills. This includes skills like creating and managing documents, working with data, and communicating and collaborating online. They also include understanding digital safety, privacy, and responsible use of technology. These are not advanced skills anymore. They are essential for everyday work. In fact, this is what we call digital citizenship, the ability to function effectively in a digital world. Health workers use these skills daily to communicate with colleagues, to share information, to create reports, and to support routine tasks. These are skills that enable health workers to move from simply using devices to confidently working in a digital environment. But even with these skills, there is another step. Moving from general digital work to using digital tools in healthcare itself. At Level 3, we enter digital health practice. This is where digital skills are applied in real healthcare settings. This includes using systems like DHIS2 for reporting, ECHIS for community health data, and electronic medical records to manage patient information. It also includes telemedicine, mobile health tools, and decision support systems. At this level, technology becomes part of your daily health service delivery work. You are not just using tools, you are using them to support patient care. Now that you've seen Level 3, we come to a critical insight. Traditionally, the digital divide is described in 3 stages: access, use, and application. Access refers to having devices, connectivity, and infrastructure. Use refers to skills, confidence, and the ability to engage safely and productively with digital tools. And application is where these tools are used to deliver real health services in practice. But in health systems, and specifically digital health, the most important divide is not just between access and use. It's between use and application. This is because many health workers already have access and many already have digital tools and are using them in their daily work. The real challenge is moving from using digital tools to applying them meaningfully in clinical practice and service delivery. We also see that gender and equity gaps influence this transition, affecting who benefits most from digital tools and who is able to apply them effectively. This is what we refer to as the digital divide shift. It is essentially about closing the critical gap between access, use, and equitable, meaningful application in health systems. We will explore this divide in more depth in a dedicated unit, but for now, it is important to understand this shift as a key turning point in digital literacy for health workers. At the top of the pyramid, we reach level 4, future-ready digital skills. This level includes emerging and advanced areas such as artificial intelligence, data analytics and data use, digital innovation, and decision support systems. At this stage, health workers move beyond being users of digital tools. They begin to work with data and technology in more advanced and strategic ways. They use data to inform decisions, to predict health trends and outcomes, and to improve the quality and efficiency of care delivery. This is where digital health becomes more than daily practice. It becomes transformational. Here, health workers are not just interacting with technology, they are shaping how technology is used in healthcare systems. And while not every health worker needs to be an AI specialist, everyone needs foundational awareness of emerging technologies and where healthcare is heading. Because this is the direction of the future health systems, data-driven, intelligent, and continuously evolving. As you've seen, digital literacy is not just one skill. It is a progressive journey from access to use to application and ultimately to innovation. And for many health workers, the most important step is crossing the divide between access and use or between use and application. This course is designed to support you at every stage of that journey. So wherever you are starting from, you can continue to grow and become confident, capable, and future ready. Take a moment to reflect. Where are you in this journey? Access, use, or application? Is there a divide in your journey? If so, where is it? In access, in use, in application? And what skills do you need to move forward? There is no right or wrong answer. This is about understanding your starting point. You have now been introduced to the Digital Health Competency Pyramid and how digital skills evolve from access to use to application and beyond. In the next episode, we'll take a step deeper and explore what digital literacy really means. We'll define key concepts like digital literacy, digital competence, and digital health. I look forward to continuing this journey with you.